we have changed the scenarios that we produce to try to reflect the concerns about new variants, particularly B.1.351 from first identified in South Africa. So we have, in addition to our normal scenario of what we think is most likely to occur, which we label as reference, we have added a rapid spread of new variants. And the way we calculate that spread is we've looked both at the data in South Africa, but also on B.1.1.7 in the UK, where there's been much more documentation going back in time. And there's enough similarity of some of the mutations that, at least for transmission tracking and rapid spread, we have used the UK data, which suggests you go from first detection to about 80% in about 100 days. And that was what's occurred in London. And now, as we're looking in other parts of the UK, the same is occurring. That model does well in predicting the speed of spread of 117 in a place like Portugal, for example, quite accurately. So we think that that's a reasonable trajectory. And we've then said, what happens if B.1.351, the South African strain, spreads at that pace around the world? So this is it's an alternative scenario. We don't know, it's showed up everywhere, but we're saying what would happen. And what we think happens with the spread of 351 is increased transmission. Again, based more on data from 117, we think that's about 35% increase in transmission. We think the infection fatality rate, that is the death rate in all those who are infected, goes up about 30%. And then, perhaps most importantly, we think the effect of the vaccines goes down.